Well, the reason it isn't on the table is because the trial lawyers, I believe, donate a lot of money to the Democrats. In reality, it needs to be. When I began my practice of medicine in 1977, my malpractice premiums were about $4,000 a year. When I retired to run for Congress, the OBGYN doctor who replaced me was about $72,000 in Tennessee. Now, in Texas, in 2005, they passed a change in the Texas Constitution, put caps on pain and suffering, not actual damages. If you were injured and you got your pay, your health benefits paid for, and your health care paid for, but it didn't pay the pain and suffering. What happened when they did that, they were down to 3 insurance companies in the state. Today they have 10. Almost 15,000 physicians have moved into Texas, including many high-risk physicians like myself, and the premiums have dropped 30%. So there's been a huge difference, and these costs, what you hear argued is it doesn't make any difference because it only accounts for 1% of the healthcare dollars. Well, that's $24, $25 billion, but, and that's right, those are the actual dollars spent, but it doesn't define the defensive medicine dollars that are spent, and estimated between 50 to 100 billion or more each year in defensive medicine. Let me give you just a real life example. A good friend of mine, great family practitioner, I've known him for years, 25 years in practice, had a very unusual event happen. He had a young woman with a dissecting aneurysm in her carotid artery at age 20, almost unheard of. And he was sued for this, didn't pick it up. And what happened the year after that, he had never had a lawsuit. The year after that, his specialists, referrals to specialists, he's a family practitioner, went up 350%, and his tests for this kind of problem, went up 550%. We all pay those costs. And what was he fearful of? He was fearful of another lawsuit. And so it adds tremendous costs, unneeded costs. It's wasted. It doesn't improve patient care, and we should do that. Other states have done it. Mississippi, California did this 30 plus years ago, where they limited caps on pain and suffering, and guess what happened to them? Premiums around the country have gone up over 1,000% since then. In California, about 300%, 350%. So it's held it to a third of the cost, and that lowers the cost of health care. One of the issues we deal with today is higher costs. Well, what they're right now, not just doctors, but patients also, they're concerned about decisions, the government getting involved in healthcare decisions. And I've said this over and over, healthcare decisions should be made between an insurance company and a patient. They should be made between a patient and their family and their physician. That's who should be making those decisions. And unfortunately, right now, that's not the case in this country. The other thing I think we're dealing with, that doctors are dealing with, is that they're looking at their costs continuing to rise, reimbursements going down. Just to give you an example, in the Senate bill, which I haven't had a chance to read, it's just been published, 1,502 pages, so the devil will be in the details. But just a short version of that, how they're going to pay for this $900 billion plan is take $400 billion out of Medicare over the next 10 years. We're going to add 3.5 million new Medicare recipients. That's the baby boomers that are starting to hit. And in 2011, the plan is to cut doctor reimbursements by 25%. So let me make sure we've got this all right. Let's do the math. You've got $400 to $500 billion less dollars in the Medicare system, 30 million more people at least, and a 25% cut with no increase for the physicians. Well, I can tell you that will sum it up real easy. You're going to decrease access, decrease quality, and increase costs. That's the ultimate thing that will happen with that. Yeah, I have read all of it, and I wouldn't recommend it. It is a chore to get through it, and it's a chore. It's written in legalese, and it takes at least 3 other manuals to read this bill. So it's an incredibly complicated bill, and just in a very short order, the health care plan, H.R. 3200 you reference, is to be administered by a commissioner, health commissioner. And this commissioner will be appointed by the president, approved by the Senate, so it'll be a cabinet level position. This commissioner has an extraordinary amount of power, and this commissioner will oversee the exchange that private insurance companies are going to be traded on, or I guess you can go there and shop for your insurance. But in addition to that, there's going to be a public option. Well, what is the public option? This is where a supposedly low-cost competitor will help the market keep the prices down on the other side. Let me give you the real world. This is experience from the state of Tennessee that tried this experiment back in the 90s, and it's still ongoing. 1993, we had costs rising, health insurance costs rising. So what do? We got a waiver from HHS, the Health and Human Services here in Washington, to try a new managed care plan. We had about 8 of them competing for Medicaid business. And in 1993, we spent $2.6 billion on this program. In 2004, $7.6 billion. It over tripled in costs. And the problem with the plan is this: with any public plan out there, this is never discussed, and you never hear it talked about anywhere. The public plans never pay for the cost of the care. TennCare, our Medicaid plan, pays less than 60 cents on the dollar for the cost. Medicare pays about 80 to 90 cents. The uninsured pay somewhere in between. And guess what happens? Those providers, the hospitals, the labs, and so forth, where do they get the rest of the money to make up those costs? They shift the cost to private insurers, forcing an additional cost onto those plans. In other words, those private plans cost more, and that's the problem with the trigger. When you see you talk about, well, we're going to have a trigger if the private plans don't keep the cost down. Well, I can guarantee you the cost will go up because the public plans never pay for the cost, and so it's absolutely will happen that they can't do it. Now, how do you help keep costs down? Well, first of all, one of the simplest things you can do is remove state lines. Let us buy insurance across state lines. Let insurance companies compete across state lines, and let people and associations form plans. And when you do that, see, pre-existing conditions are only a problem in the individual market. You and I going out and try to find, or very small businesses where there are 8, 10, 12, 20 employees. One person gets a very bad illness and it runs the cost up for everybody. But in a large plan, let's say you have 300,000 people in a plan, you can take all the people with pre-existing conditions because those costs are shared among a lot of people. Well, certainly it can pass. I mean, the Democrats have a clear majority in the House, 40 votes, and in the Senate, 60 to 40. So they can pass any bill they want to. The problem with all of these plans are they have ignored what's happened in Massachusetts, what's happened in Hawaii, what's happened in Tennessee. Let me give you an example. In the Senate plan, we're going to expand Medicaid. Well, what that is an unfunded mandate for state government. Our governor, who's a Democrat, Phil Roe, is doing a yeoman's job at trying to control costs, but he estimates that if just that plan is initiated, the state of Tennessee, which had an $800 million to $1 billion shortfall in revenue last year, this plan in just 5 years will cost $735 million. And if the plan is required to pay the same as Medicare, it'll be a $3 billion, but we don't have the money. What are we supposed to do in Tennessee? Cut K through 12, cut higher education, cut the highway patrol, quit paving roads? I mean, what are we supposed to do? And that's a part of the bill. That's the unfunded mandate that the states get. For California, it's estimated $8 billion a year. Well, they've had a huge shortfall this year. What's California supposed to do? So will the public option occur? I don't know. For me, it's a deal killer. I've seen what it will do in Tennessee. It almost broke the state. So there's no way in the world I'm going to vote for that. There are certainly a lot of other ways that Republicans and Democrats and the President can get together and pass meaningful health care reform without a public option.